14 more days. That's what the Prime Minister said, that we have to sit tight because surveillance testing is required. On the phone to tell us more what that means for us here in Trinidad and Tobago is our very own Dr. Erica Wheeler, WHO representative and PAHO representative for Trinidad and Tobago and the Dutch Caribbean Islands. Good morning, Dr. Wheeler.
Good morning, Lisa. How are you today?
I am good. I'm always good, Dr. Wheeler. Always in high spirits.
Very good.
All right. So I know that the Prime Minister said that we need 14 more days so that the experts can undertake what is known as surveillance testing. Can you give us an idea exactly what does that mean?
Okay, so you may recall that recently the chief medical officer mentioned that they would be doing some community testing. So beyond the actual testing of persons who have been suspected of having COVID-19, they are now testing in the community. At identified clinics, according to the chief medical officer. So it means they're trying to pick up what is out there, not only the people who have been suspected and their contacts traced, but they want to know what is available out there. And it's one of the steps that you need to take as part of the measures of understanding, do you have swine flu? Do you have H1N1? Do you have COVID 19 out there? What is circulating in the
Mm-hmm.
community? So that's one of the things it means by when we talk about surveillance testing.
Okay, so persons are getting anxious. Especially those who work, the self-employed, and have no means of, alternative income, and they're asking, why can't we go out there? Why can't? Why? So, can you explain? What can this be done simultaneously? Why is it that persons are being asked to remain indoors?
Okay, so that is a really very important question. When you are in a situation and you have to start relaxing measures of containment that have been instituted by COVID 19, you have to look at a range of factors. The socioeconomic factors, of course, are important because we must balance lives with livelihoods. But we also have to understand that there's certain public health
That was
measures
almost
that
it.
the
Yeah.
government is responsible for that must be in place when we have a situation where we're relaxing measures. So, for example, if you want to say persons have to be allowed to go back out to work, you have to be certain, for example, that workplaces are safe because you can't just let people go back out to work without knowing that your workplace actually is the people at work, they know what to do in terms of not just all the personal hygiene that we're seeing, but the sanitation of the workplace, making sure that there's a way of people identifying if someone is ill, what do they do at the workplace? Is there a room they can go to that they can isolate them until they can be tested, until they can leave to be tested? Do you
Mm-hmm.
have masks at the workplace? Do you have a flexible occupational health and safety policy so that persons can get time off when they're ill? There are a range of things
Yeah.
that must be done also for the country itself. You
Mm-hmm.
don't want to take measures that means when you open back up that people are immediately exposed, because you have to think of the capacity of the health system to
Mm-hmm.
accept people
But
at any level of severity, whether it is mild or severe. If
yeah,
it's very mild, of course, they never end up in hospital, but you
yeah.
have to take this into consideration.
But can
Do
all
you
of this be
have
done in, Dr. Wheeler, can all of this be done in 14 days? Seems to me as if this is going to be with us for a little while longer.
Oh, but the 14 days, the reason why one chooses 14 days is that 14 days is the incubation period of the virus.
Mm-hmm.
So, what you do is you start relaxing your measures and you wait 14 days to see what changes there are. So, in 14 days, there could be relaxation based on excuse me, at least six different criteria. So the 14 days is the period where the government needs to observe through surveillance what is going on in terms of COVID 19 circulating in the country. So it is a credible period of time in which to wait. It doesn't mean that everything will happen in 14 days,
Right.
because that's not what WHO and PAHO recommends. We recommend that you relax the measures and you wait 14 days and you observe through surveillance, testing, isolating people, and treating them what is actually going on in the community. So that's the significance of 14 days, waiting 14 days. So, for example, hardware stores have been due to be opened half day every day.
Mm-hmm.
What does that look like at the end of 14 days? Are there more cases? Do the cases remain the same? Because you have to remember that it is the level of transmission in the country
Yes.
that one needs to look at. And
Mm-hmm.
all our cases were imported, and the other cases were those who were connected to the imported cases. So we have what's called sporadic cases, it's not community spread.
Mm-hmm.
So that is the basis on which, there's six different areas, as I said, but I mentioned surveillance. I mentioned the capacity of the health services to cope. I mentioned the ability of businesses to observe all of the hygiene practices that are necessary. And I mentioned even the infrastructure of the health services so that they are ready to receive people. So the 14 days is just an initial measure.
Yeah.
It doesn't mean everything can happen in 14 days.
And you mentioned that WHO gave guidelines with regard to the relaxing of the measures. And what does this look like? How does this roll out in terms of relaxing of the measures? Do you have an idea as to what that would look like?
Okay, so the recommendations by WHO and PAHO, they say quite clearly that it depends on the level of transmission in the country. If it is low, then it means that there are certain measures that can be taken compared to if it's what you call community spread. With community spread, it means it's everywhere and anybody may have it. So, therefore, having social distancing measures for a longer period of time is more sensible when you have community spread. So, it really depends. For us, we have sporadic cases, all imported. Through contact tracing identified. So it's not, we have a menu of measures, and the menu of measures needs to be matched to the public health situation.
Mm-hmm.
So making sure that the current cases um, don't don't explode. So if you have over 14 days, you see there's not an explosion, not an increase, a sudden increase in cases. If you relax measures, it means that you can maintain those measures. You also have to take into consideration the acceptability of these measures, the communities, and their ability to accept and support the government in the measures that are taken. So you have the health service, you have the transmission, you have the capacity of the health system to cope, you have the risk of vulnerability and high in settings where there's high vulnerability, like prisons or nursing homes. So you see, for example, some prisoners were being released. What is happening very soon is that the government is putting out guidelines on infection prevention and control for nursing homes. They say no visits to nursing homes, so you protect that group of people. So those are things that can go on longer. So things that you can control and that are acceptable and don't cause a lot of serious socioeconomic damage. If you only have local transmission like we do, you can relax some of those measures, wait 14 days, observe if there are any changes, and that you continue. For workplaces, we gave Dr. Basso, our epidemiologist, and I gave a presentation on what should be done for workplaces. You have to observe all of the rules and the public health guidance for workplaces if you want to open workplaces, and that's going to be challenging because businesses have to be responsible and do social distancing even within the workplace. You will have to say to people, for example, if you're not feeling well, do not come into work, which we've said before. But if you're at work, you will have to have people who sit 6 feet apart, for example. You may not want to have meetings where you invite a lot of people in, or
Yeah,
if they get invited in, they observe the rules of the business place in terms of social distancing.
yeah,
People don't share utensils. Not everybody may come to work at the same time. You
yeah.
may
So
have
it's
to
a hard
stagger
task.
people coming into the workplace,
Yeah,
ensure that good hand hygiene is observed. All these things you will have to look at.
yeah. There's
If
a
you want to even
checklist.
go further and
Yeah,
open up your borders, you have to have extremely good infrastructure, personnel, in terms of your human resources. You
mm-hmm.
have to have the ability to quarantine people,
Yeah.
and
Well,
all of those
I know
things.
that you
The
gave
more
you
measures.
gave some of those measures to the chamber for their members to observe. Carrie is here with me, and I know he has some questions for you as well, Carrie.
Sure,
Good
sure.
morning, Dr. Wheeler.
Good morning.
So I was wondering, just to backtrack a little bit, when we speak about the surveillance testing, um, in the from the WHO's standpoint, is there a guideline as to the means by which the testing should be done? Is there a ratio of, one in a certain number of people that should be tested at random? And what about the case of people who are asymptomatic? What guidelines are there in regards to controlling possible spread by those who are not showing signs of the
Yes.
disease?
Yes, the asymptomatic issue is one of the most tricky issues. We are not sure what percentage of a population is asymptomatic as different from pre-symptomatic, because you could not show symptoms and then in 3 or 4 days or less you can show symptoms. So we don't have any global understanding of what percentage of people may be asymptomatic compared to people who are pre-symptomatic. In every population, you have to expect that not everybody is the same. So you will have people who are pre-symptomatic, for example. The asymptomatic, we have to pin that down a bit better. The science on the percentage of people who are asymptomatic is not quite there yet, simply because they are asymptomatic, if you see what I mean. And that is
Right.
the most concerning bit. But there is no specific ratio of how many people you should test in a population. But what we do advise is that you do community testing,
Oh,
because, as I
no.
said, in that way you would know, in a case,
Oh,
for example, like Trinidad and Tobago, where we have sporadic cases, which are cases that have been identified, and you also know their contacts through contact tracing, then community testing is good, because you want to know, apart from the people who you've captured and who have tested positive, who else in the community might have COVID 19 or anything else for that matter.
Mm-hmm.
So that is why. That word surveillance, that just really means surveying the number of people in your population who has a particular disease. That is why that is important at this time when we are thinking of relaxing measures. But you would have an indication of the level of the problem you have based on the number of people that end up in hospital,
Right.
especially those who are um, maybe not only the severe cases, but those who need some kind of hospitalization. So that gives you an indication of whether you have community circulation or not. And that's why
Right.
it is important to do surveillance testing.
Right.
You
And
have to
one more
remember
question,
this is a
doctor.
new disease and we're learning about it.
Yeah, one more question, doctor, before we go. In real terms, is it that, well, from the WHO's standpoint at least, and PAHO's standpoint, is it that we are not safe until there's a vaccine? Or are we able to come out of this without one being created?
Well, we can't be completely safe until there is a vaccine. And that is why there is such a race to find a vaccine. Also, we are trying to find treatments before there's a vaccine, possible treatments. That's why there's this solidarity trial going on with 90 countries across the world testing antivirals to see if any of them are effective. So we cannot say that we are completely safe until we find a vaccine. That is why it is important to still observe public health measures, but governments are sovereign and they decide based on their transmission classification. And I really have to emphasize this because if you have imported cases and only local transmission from those imported cases, compared to if you have community transmission, your public health measures will be significantly different
Yes.
because you will have to, and we may have to have cycles where
Yeah.
you have some relaxation and then some restrictions,
Yeah.
depending on if when you relax your measures, your public health measures, whether the numbers increase. There is a ratio that's used, it's a formula, and it should be no more than one when you work out the formula.
Right.
It's difficult to explain, but there is
Yes.
actually a formula which says
Well,
you need to make sure that your cases don't go above a certain amount. And if they do, then you know you have to start restriction measures again.
again,
So there is some science
yeah.
behind actually identifying if you should close down again after you open based on the number of cases that you see. There's a
Right.
formula that you can work out
Well,
that
Dr.
helps to
Wheeler,
guide the
you are with us every Tuesday. I got to stick a pin in it there because we have a hard
Yes.
stop at 7 o'clock for the news. But you're with us next week, and we'll continue this conversation. I want to really thank you for coming out religiously every week with us to help us answer some of these questions that the public is asking. And Dr. Erica Wheeler there, the WHO PAHO representative for Trinidad and Tobago and the Dutch Caribbean Islands. And of course, this segment, Coping with COVID, brought to you by NGC.
Coping with COVID-19, brought to you by NGC, at the forefront of energy.